Hi, I'm Tom from the First Aid Training Co-operative, and in this video I'm going to show you how to treat somebody who you suspect might be suffering from shock. For a casualty who has had a significantly bleeding injury, either internal or external, we always assume that they might suffer from shock and treat them accordingly. If your casualty is suffering from shock, you might find that they become cold or are clammy to touch. They might have fast or shallow breathing. They might be quite anxious or quite worried, and if you took a pulse, you might find that it was quite fast and also quite weak. So how do we treat our casualty then? The first thing we need to do is we need to treat the injury. So in this case, I've bandaged up Corey's arm and I've left it up on his chest. I'm going to get Corey, my casualty, lying on the floor, okay, while he's conscious. That allows the blood to stay where it needs to be in his core and his head, and because he's conscious, I'm able to raise his legs up and put them on a chair, which gets more blood from his legs into his body. If he was unresponsive, remember, we would always roll him into a recovery position. Other things I'm going to do, he was telling me he's feeling cold, so I'm going to cover him up. In this case, I'm using just a fleecy blanket, but in a different scenario, I might have a foil blanket to use, or even just jackets, something like that, to keep him nice and warm. I'm going to give him lots and lots of reassurance, and included in keeping him warm is putting a hat on as appropriate, or maybe pulling his hood up, something like that. So lots of reassurance, talk to him nicely, tell him that everything's going to be okay, and meanwhile I'm going to call the emergency services and tell them what I've found. In summary then, anyone who you suspect has been significantly bleeding, we're going to treat them for shock. This involves lying them down, raising their legs if they're conscious, keeping them warm including their head, reassuring them, and calling the emergency services.